Is trauma damage to the brain permanent? Trauma to the brain can sometimes cause lasting effects, but whether the damage is permanent depends on the type and severity of the injury. When we talk about trauma affecting the brain, it's important to distinguish between physical injuries and emotional or psychological trauma. Physical trauma, like a traumatic brain injury, can lead to structural damage such as cell death, brain shrinkage, and disruptions in how different parts of the brain communicate. These injuries can sometimes cause long-term or even permanent changes, especially if the damage is severe. For example, in cases of moderate to severe traumatic brain injury, some individuals may experience ongoing difficulties with memory, attention, or movement. However, the brain has a remarkable ability to recover and adapt over time. Neuroplasticity, the brain's capacity to reorganize itself, can help restore functions that were impaired. Treatments like targeted rehabilitation, cognitive therapy, and even certain types of electrical stimulation can support this process. While some damage might be permanent, many people experience significant improvement in their symptoms with proper care. Advances in medical science are continually improving our understanding of how to promote brain recovery after injury. When it comes to emotional trauma and post-traumatic stress disorder, the effects on the brain are different. Trauma can cause changes in brain regions involved in emotion regulation and memory, such as the amygdala and hippocampus. These changes can affect how a person responds to stress or remembers traumatic events, but these are not necessarily permanent physical damages. The brain is highly adaptable, and with effective therapy and support, many individuals can recover or experience substantial improvement. For some, the brain's ability to rewire itself means that the effects of trauma can lessen over time, especially with treatment. In summary, physical brain injuries can sometimes cause permanent damage, but recovery is often possible, especially with early intervention and ongoing therapy. Emotional trauma and PTSD tend to alter brain function rather than cause irreversible damage, and the brain's plasticity allows for healing and adaptation. It's important to remember that each person's experience is unique, and outcomes can vary widely. Consulting healthcare professionals for personalized assessment and treatment is always the best step. While trauma can have serious effects, the brain's capacity to heal and adapt offers hope for many individuals.